Okay. Okay. Hello, everyone. Welcome to JFrog 2022 Literature Online Course Series 2. My name is Julia. I'm a medical supervisor in the medical and marketing team. So today we will mainly talk about the new literature in 2022. And then I will interpret some important literature. During the course, please make sure muting yourself. And if you have any questions, please feel free to text in the chat box. Our medical team members, Lisa and Sam, will answer your questions. Okay, let's start. My presentation will contain these three parts. The first part is about 2022 new publication review. The second part is about publication interpretation. The third part is the summary. Let's see the first part. So here's a table which shows the 2022 new literature. So these literatures increase all of the models of our products, and the different indications are included in these literatures, like maintenance hemodialysis, thyroid storm, and this thyroid storm is a new indication for HA130, and the carbamazepine poisoning, pilocarpine poisoning, and the critical care like sepsis, COVID-19, and severe multi-system inflammatory syndrome in children. And the liver disease like acute oncologic liver failure and severe bilirubin and hepatitis. And these literature are from different countries like China, Philippines, Australia, Ecuador, Turkey, Thailand, Argentina, Colombia, Malaysia, Italy, and Kazakhstan. And here shows the unpublished manuscripts sharing. The first one is about HA330 applied in severe burn. And this is a new indication for HA330 from Philippines. Another one is about DPMAS therapy applied in acute liver failure from Lithuania. So in the next part, I will interpret some important literature. So firstly, let's do a Q&A about HA130. So what is the recommended treatment scheme for HA130? Everybody, please text your answer in the chat box, and I will give you 1 minute, and then I will check your answer. So please give your answer in the chat box. The answer is the multiple choice. Okay, I see that most of you chose all the answers. Yes, the correct answer is A, B, C, D, all the choice. So for HA130, we recommend 4 times a month. 4 times a month, and the maintenance program we recommend 1 to 2 times a month. And for the treatment duration, we recommend 4 hours when HP compared with HD or HDF. And for sure, the treatment regimen should be adjusted according to the patient's conditions. Okay, let's move on. So here's a study about HA130 applied in maintenance hemodialysis. Maintenance hemodialysis. So this study has been published in Blood Purification this year. We all know that hemodialysis is limited to remove the middle to large molecules and protein-bound molecules. So the patients with long-term hemodialysis usually have a macro-inflammatory state, especially for the elderly patients. So this study aimed at investigating the effects of hemodialysis compared with hemoperfusion on macro-inflammatory state in elderly patients with maintenance hemodialysis. There are total 115 patients included in the study and were divided into control group and observation group. And in the control group, 75 patients received HD treatment alone for 4 hours at a time and 3 times a week, and continued the treatment for 6 months. And in the observation group, 75 patients received HA113 plus HD treatment for 2 hours at a time, once a week, and also received HD treatment twice a week and continued the treatment for 6 months. So let's see the results right here. Compared with the control group, the observation group significantly increased the scores of quality of life, such as the psychological aspects, the physiological aspects, the social aspects, environmental aspects, and the independent ability. And also we can see the table right here. The table shows the comparison of the differences of the inflammatory levels between the two groups. We can see that compared with the control group, the observation group significantly reduced the level of C-reactive protein, homocysteine, and interleukin-6 and TNF-alpha. And also the observation group significantly decreased the incidence of the adverse effects like dry mouth, skin reaction, and so on. And also the observation group significantly increased hemoglobin, total protein, albumin, and so the study concluded that the clinical effect of HD compared with HP is significant. It can effectively reduce the level of inflammatory mediators and improve the scores of quality of life and the nutritional level. And this kind of therapy is worthy of promotion and application. So here is another study about HA113 applied in thyroid store. So the thyroid store is a new indication for HA113. This study has been published in Winchester this year. And the objective of this study is to discuss the use of hemoperfusion as alternative option in thyroid store when the medicine treatment is contradicted. And a 72-year-old male diagnosed thyroid store was presented in this study and received HA113 hemoperfusion for 3 hours in 3 consecutive days compared with hemodialysis. The figure right here shows the connection of HA113 with the dialyzer. And after the treatment, the patient had rapid improvement of hemodynamics. And we can see the figure right here. Before the treatment, the level of FT4 is about 2, where after the treatment, the level of FT4 reduced to 1.31. So the study concluded that HA113 hemoperfusion can be an alternative option for treatment of thyroid storm when the medicine treatment is contradicted. And also the therapy can be a cheaper alternative and as bridge before surgery. So what can we learn from HA113? Firstly, we recommend HA113 once a week and 4 hours each time. And HA113 can be applied in the in ESRD and thyroid store. So why should we recommend HA-130 hemoperfusion in clinical? We all know that conventional hemodialysis has a poor removal effect in middle to large molecules and protein-bound molecules, where hemoperfusion can effectively remove these toxins in uremic patients. So the nephrologist will have interest in this kind of therapy. And the key benefits of HA-130 are to reduce the level of microinflammation, improve quality of life and nutritional level, reduce the incidence of adverse effects, and stabilize hemodynamics. And HA-130 can mainly remove middle to large uremic toxins and protein-bound uremic toxins and the level of FT4. So what are the commercial opportunities of HA-130 hemoperfusion? So clinical studies show that HA-130 has significant clinical effect, and it can be a cheaper alternative, and it has the good biocompatibility. And also, it's very easy for doctors and nurses to operate. So the next part is about HA-230. And firstly, let's do the Q&A right here. Which of following substances can be absorbed by HA-230? So everybody, please text your answer in the chat box. So the answer is the multiple choice. Okay, so all of you chose A, B, C, D. Yes, the correct answer is A, B, C, D. HA-230 can absorb piloCAM, carbamazepine, organophosphate, and digoxin. Okay, let's move on. So here's a study about HA-230 applied in carbamazepine. It has been published in blood purification. So the carbamazepine is the small molecules, and also it's a highly protein binding molecules. So the dialysis and hemoperfusion therapy can applied in carbamazepine removal. This report compares the mass removal of carbamazepine using hemoperfusion with CVVH. So a patient with massive carbamazepine intoxication was presented in this study. So firstly, the patient received CVVH therapy and then received HA-230 hemoperfusion therapy compared with CVVH. And we can see the table 1 right here. After CRRT treatment alone, the carbamazepine level reduced from 28 to 16, where after CRRT plus HP, the carbamazepine level reduced by 15% from 16 to 8. It's far more rapid than that in CRRT alone. And also we can see that the carbamazepine removal rate in CRRT alone is just none, and where the carbamazepine removal rate in CRRT plus HP reached 13.5. So the study concluded that the combination of CVVH and hemoperfusion can be very easily conducted, and the therapy is safe. And also the combination therapy maximized the carbamazepine removal. So what can we learn from HA-230? Firstly, we recommend HA-230 for 3 days and 4 hours each time. And HA-230 hemoperfusion therapy can be applied in drug overdose and poisoning. So why should we recommend HA-230 in clinical? We all know that charcoal hemoperfusion has been widely used in poisoning, where it's harmful to the blood cells, and it has the poor biocompatibility, and it has the weak skeleton so that it will easily break off and form embolism. So where HA213 resin hemoperfusion has been proved to be effective in Ponzini patients, and it doesn't carry the risks of charcoal hemoperfusion. So the emergency doctors and anesthesiology and ICU doctors will have interest in this kind of therapy. The key benefits of HA213 is to clear the level of overdose drugs and poisons. So what are the commercial opportunities of HA213? Firstly, it can be very easy to operate in clinic, and also it's safe, and it has the significant efficiency. So this part is about HA330 and HA318. So firstly, let's do the Q&A right here. What are the main clinical applications of HA330 or HA318? So everybody, please text your answer in the chat box. I will give you 1 minute, and then I will check your answer. So what are the main clinical applications of HA330 and HA318? Okay. Yes, the correct answer is A and C. All of you, well done, good job. So the HA330 and HA318 can be applied in sepsis or septic shock and the trauma and the burn. And for trauma and burn, our global advisory board is conducting a clinical trial, and hope we can get more evidence about this kind of indication. And for liver failure, we recommend DPMARS therapy. And for ESRD, we recommend HA130. Okay, let's move on. Here's a study about HA313 applied in severe COVID-19. It has been published in Blood Purification this year. So we all know that since 2020, COVID-19 has spread all over the world. And COVID-19 patients may progress to critical illness due to the uncontrolled inflammatory state, and which will contribute to multi-organ failure and death. So this prospective cohort study aimed at investigating the efficacy of HA313 hemoperfusion in combination with standard therapy in severe COVID-19 patients. There are 29 patients enrolled in this study. In HP group, 15 patients received HA313 hemoperfusion therapy at least 3 sessions, and each session lasted 4 hours, and also compared with the standard therapy. In control group, there are 14 patients received the standard treatment alone or received less than 3 sessions of HA313 hemoperfusion therapy. And we can see the results right here. Compared with the control group, hemoperfusion group significantly decreased the SOFA score and the hyperinflammatory marker C-reactive protein. And also we can see the finger right here. The blue line is the control group, and the red line is the hemoperfusion group. We can see that compared with control group, hemoperfusion group significantly reduced the 28-day mortality. And also HP group significantly increased the mechanical ventilator free day. So the study concluded that in severe COVID-19 patients, The addition of only HA313 hemoperfusion to standard therapy improved the organ failure and reduced the mortality rate. So here's another study about HA313 applied in sepsis. Sepsis triggers the release of inflammatory cytokines. So the study aimed to analyze the laboratory and clinical results of cytokine hemoadsorption as an immunomodulation therapy in patients with sepsis or septic shock. There are 32 patients enrolled in this study, and they received the HA313 hemoperfusion therapy. So we can see the primary outcome right here in this table. After the treatment, the level of interleukin 6, interleukin 8, interleukin 10, TNF-alpha, PCT, CRP, a PICA, mortality rate, and SOFA score significantly reduced. We can see that no matter during the treatment or after the treatment, the level are significantly reduced. So the study concluded that the progression of sepsis in ICU patients may be prevented with cytokine hemoadsorption applied as an immunomodulator therapy. So here's another study about HA313 applied in a new indication, the severe burn injuries. So this study is about the unpublished data. So the mechanism involved in the pro-inflammatory state in severe burns causing multi-organ failure. So the management of severe burn injuries with COVID-19 infection during the pandemic was a challenge. A case of 29-year-old male with severe burn injury with positive COVID-19 was presented in this study and received HA313 hemoperfusion therapy for 3 consecutive days. And after the treatment, the patient's urine output eventually improved, and also the inotropic support was tapered down on the 3rd day, hospital day. And we can see the table right here shows the summary of serum biochemical markers and the blood counts. After the treatment, we can see that the PCT level reduced from 22.55 to 5.15. And the level of creatinine reduced from 2.27 to 0.67. And also some other biochemical markers was improved. The patient was hospitalized for 96 days in total and was finally discharged and recovered. So this study concluded that in patients with severe burn injuries, the decision to do hemoperfusion on the critical phase is very important. So what can we learn from HA313 or HA318? So firstly, we recommend 6 to 8 hours each time in 3 consecutive days. And HA313 or HA318 can be applied in critical care like sepsis or septic shock, severe burn, COVID-19, and other disease related to cytokine release. So why should we recommend HA313 or HA318 in clinic? The mechanism involved in the pro-inflammatory state in sepsis or septic shock, severe burn, or COVID-19 or other disease related to cytokine release, where HA313 or HA318 can mainly remove the level of inflammatory mediators. So the anesthesiology and ICU doctors will have interest in this kind of therapy. The key benefits of HA313 or HA318 are to lower SOFA score, lower the mortality rate, reduce mechanical ventilation, and improve renal injury. And they can improve they can significantly reduce the level of interleukin-6, TNF-alpha, PCT, and CRP, and the level of creatinine and lactate. So what are the commercial opportunities of HA313 or HA318? The clinical studies show that HA313 or HA318 is safe and well tolerated for the patient, and also it's effective. And also this kind of therapy can refresh doctors' knowledge of hemoperfusion. So the next part is about DPMARS. Firstly, let's do the Q&A right here. So which indication can DPMARS therapy be applied in? Everybody please text your answer in the chat box. So the answer is the multiple choice. All about? Okay, I think that most of you chose ABC. Yes, the correct answer is ABC. So for sepsis or septic shock, we recommend HA330 or HA318. So DPMARS therapy can be applied in liver failure, hepatitis, and jaundice. Okay, let's move on. So here's a study about DPMARS applied in acute oncologic liver failure from China. And the study is a meta-analysis. So we all know that acute oncologic liver failure is a common severe liver disease, and it will progress rapidly with high mortality rate in a short time. And nowadays, the liver transplantation is the only certain way for liver failure, but it is limited by the lack of donors and the high cost. So the meta-analysis study was conducted to assess the efficacy of DPMARS applied in acute oncologic liver failure. So a total of 1,710 articles were researched, and 11 articles were included. 4 of them compared DPMARS with PE, and 7 of them compared DPMARS plus PE with PE. And the results concluded that compared with PE, DPMARS could better improve total bilirubin, 19-day survival rate, and the coagulation. And the DPMARS plus PE could better improve total bilirubin, albumin, ALT, the adverse reactions at the 19-day survival rate, and the improvement rate. So we can see the 2 fingers right here. The control group is the PE group, and another group is the DPMARS group. We can see that compared with the control group, the DPMARS group significantly reduced the level of total bilirubin. And another picture right here shows the comparison between DPMARS plus PE with PE. We can see that the compared with PE group, DPMARS plus PE significantly reduced the level of total bilirubin. So another study is also about DPMARS and applied in acute liver failure from Lithuania. And this study is about the unpublished data. So DPMARS is a blood purification system which has been proved to be effective in bilirubin reduction and mortality rate. And this system includes solvent BS313 and HA313 too. A 28-year-old patient presented in ICU with progressive jaundice for 3 days, received 4 sessions of DPMARS therapy when the level of total bilirubin reached 514. So we can see the results right here in this table. The total bilirubin level reduced from 514 to 145, and the direct bilirubin level reduced from 444 to 115, and the indirect bilirubin level reduced from 96 to 30. And also we can see that the interleukin-6 level reduced from 464 to 328. So the study concluded that DPMARS productively reduced the level of total bilirubin, indirect bilirubin, direct bilirubin, SGOT, and SGPT, and the volumes of the volume of reduced bilirubin reached 13 to 15%. So here's another study about BS313 applied in severe hyperbilirubinemia from China. So the severe hyperbilirubinemia after cardiac surgery increases in hospital and 1-year mortality. The study aimed to analyze the safety and efficacy of bilirubin absorption in patients with severe hyperbilirubinemia. And there are 25 patients enrolled in this study and received BA treatment. And each patient received 2 to 3 hours BA treatment each day. So we can see the outcome right here in this table. The level of AST and ALT significantly reduced after the treatment, and the level of total bilirubin reduced from 431.65 to 324.83, and the conjugated bilirubin level reduced from 321.94 to 263.25. So the study concluded that BA treatment should be considered as an effective and safe method for the reduction of serum bilirubin in patients with severe hyperbilirubinemia. So what can we learn from DPMARS? So DPMARS therapy can be applied in liver disease like acute unclonic liver failure, hepatitis, and severe hyperbilirubinemia. So why should we recommend DPMARS therapy in clinic? The liver transplantation is the only certain way for liver failure, but it's limited by the lack of donors and high cost. And also, P therapy is limited by plasma dependence, unstable dynamics, and the risk of dissemination disease and allergic response, where DPMARS therapy was proved to be effective, and it can be complement therapy in the liver failure patients. So the hepatology doctors and infections doctors will have interest in this kind of therapy. The key benefits of DPMARS was to lower the mortality rate and reduce the incidence of adverse effects, and it can mainly remove the level of bilirubin, bile acid, and inflammatory mediators. So what are the commercial opportunities of DPMARS therapy? The clinical studies show that DPMARS therapy is safety and has highly cost effectiveness. And also DPMARS therapy can enrich the therapeutic strategy. Okay, the last part is about the summary. So for critical disease, we recommend HA313 or HA318 because HA313 and HA318 can mainly remove the level of inflammatory mediators. And also the clinical studies show that it can lower the mortality rate, reduce mechanical ventilation, lower SOFA score, and improve renal injury. And for ESRD patients, we recommend HA113 because HA113 can mainly remove the middle to large uremic toxins and the protein-bound uremic toxins. And also it can reduce the macro inflammation, improve quality of life, and improve nutritional, reduce adverse effects, and stabilize hemodynamics. And for liver failure, we recommend the DPMARS therapy because it can reduce the level of bilirubin and the bile acid, and also it can lower the mortality rate, reduce the incidence of adverse effect. And for drug overdose and poisoning, we recommend HA213. And because HA213 can reduce the level of the drug overdose drugs and the poisons, and also it can improve the survival rate. So for all of our products, a lot of clinical study has shown that it's safe technique and without obvious side effects. And also it's easy to perform in clinical for the doctors or nurses, no matter in single mode or the combination therapy. And also our products could be performed in children or adults. And nowadays, the new clinical indications and the large-scale studies become more and more available. So this part is about the CREATE Project 2022. I believe that most of you know this project, but just in case, I will give a simple presentation about this project. So what is the CREATE project? It's the clinical evidence collection for the JEFRON hemoperfusion experience. We hope to encourage more doctors in this field from overseas countries to share their experience about our products and submit the manuscripts to us. And here shows an invitation. So after the course, I will send the invitation to all of you. You can send the invitation to the doctors and invite the doctors to submit and share their experience to us. So if the doctors submit the manuscripts to us, we will give the related rewards to the doctors. And I hope we can connect more and more clinical evidence through this project. So the next part is about JEFRON Medical Center. I believe most of you will need to search the literature about our products. JEFRON Medical Center will be very convenient and useful for you to search the literature about our products. If you, for example, if you want to search a certain literature, you can copy the title of the literature in the search box, and then you can access the literature you need. And also our medical team has managed a lot of labels for you to search the literature, like the department, model, targeted substances, benefits, and so on. It will be very useful for you to search the literature. And also you can share the website to the doctors and to invite more and more doctors to use the JEFRON Medical Center. So the last part is about the publication of the week and the literature brochure. So besides the literature interpretation online course, our medical team regularly make the publication of the week and will summarize the new literature as a poster like the finger right here. and we'll launch the poster in our social media like the LinkedIn, and you can follow the account. You can follow the account, and then you can get the updating information about JFROM. And recently, our medical team is making the literature brochure, and we will summarize 14 key literature about all the models of our products. And here shows a template of our literature brochure. We will output the literature brochure before September. I believe that the literature brochure will be a very important tool for clinical promotion. So let's look forward to the literature brochure together. So let's all thank you for your listening. And if you have any questions, you can text in the chat box. So anyone has had any questions? Yeah, sure. The invitation to the Create Project 2022, I will send to you after this course. So this is my email. If you have any questions after the course, you can send the email to me. Okay. Yeah, sure. This presentation I will send to you through the email. So everybody, the slides and the invitation to the project Create 2022, I will send to you through the email. And also, if you have any questions, you can send email to me. I text my email in the chat box. Sure, the video we can share with you. Okay, any other questions? So if no other questions, we will end this training. Okay. Thank you for your listening and thank you for your participation. Okay, bye-bye.